Alright, so welcome to today's talk. Today is just a random thought I had in my mind. Many years back, famous Pierre Schmidt from Geneva, Switzerland, he's written in his book Art of Interrogation and Art of Case Taking that during the case taking he would often use an ophthalmoscope and see the iris of the eye, and depending on that he is to evaluate the personality, whether he's talking the truth. We imagine we are not giving so much importance to the examination of eye in our case taking. So let me talk a little bit about this, and especially in emergency cases, difficult cases, one should know how to use and how to examine the ophthalmic symptoms. So we'll talk a little bit about pupils and different types of pupils. What you see here is a different pupil to what you see here. Here you can see a dilated and a pinpoint pupil. Different to here. In repertory, there are different rubrics for pupils. For example, there is a rubric pupil dilated in anasarca. So when patient is with dropsy, you check the pupil, it is dilated. Remember the remedy Helleborus. If you examine the eye with the tumor in the brain and there is effusion, think about the remedy Kali iodicum. I've used this remedy with very good results. But one should also know what does the pupil actually indicate. The constricted pupil indicate often a depressing drug. The dilated pupil may indicate head injury, a dropsy, a swelling, a shock, a stimulant. Failure to accommodation may also indicate a major brain injury, alcohol, drug poisoning. The response of the pupil is more important than the size. Here I have given a little bit of a diagrammatical understanding of different pupils. Cocaine, see what happens in cocaine, see what happens with atropine, then you can understand with belladonna, adrenaline, physostigmine. One of the cases I saw when I examined, I could see a little bit of you can see a wrinkling of the forehead like this. It was a very bad case of a brain edema. It was a tuberculoma of the brain. So I looked at the rubric wrinkled forehead in brain disorders. Helleborus was the remedy. So you have to connect these different patterns. That is what homeopathy is all about. And there are so many different expressions. There is a rubric, you should know this. Pupils contract and alternate dilate. One of the remedy there is strophanthus. Only one pupil is dilated. Remember natrum frost. Unequal pupil. Hyoscyamus is a very important remedy here. One patient used to tell me, I constantly feel there is a foreign body which is here. The remedy is coccus cacti, remember. Foreign body sensation between the eyeball and the eyelid. This is so clinically verifiable. Patient come and tell me, and they, nowadays patients, many patients are coming with dry eyes. Retina is inflamed, retina is degenerating, glaucoma, early glaucoma, early cataract, retina inflammation from overuse of ice. Remember the remedy sulfur. A lot of homeopaths come to me that we are using a lot of software, we are watching a lot of Netflix. Very times I use picric acid, remarkable remedy. One of the patient I went to see in the hospital, ICU case, there was eye motions, pendulum like this, with the eye closed. One of the remedy that I gave was cocculus. There was a whole detailed history. Oscillation of eyeball. So this is what you have to learn. This is an art. It's a mastery. And I hope that you read about all these different literatures. My 2-3 new books are coming. I have written a new book on sarcodes and nosodes. My another book is on mind rubrics. I'm writing a book on coma now. Also how to treat cases of coma. So life seems amazing if you look at it at the right way. It's all your perception. All power is within you. I'm looking forward to see all of you. So you can write to me. Um, you know my email ID, gaurang@gmail.com. You can see my videos and yeah, stay strong, be brave.